Hello, hi Christian.
Hello, how are you?
Good, and you? Nice to see you.
I see you.
Hi,
Lot of
Christian.
lot of familiar faces.
We'll just wait for 2 minutes while others join. Hello, Catriona. Thanks for joining us.
Hi there.
Hi.
Hi. Kristen, it must be the middle of the night for you. No?
Yes,
Dare I ask?
it's only 9:30 right now.
Ah,
Um, yeah, it's fine. Except we are living in a caravan, so I've kicked my other half out for now. Well, we're traveling the country, so yes.
Hi, everyone.
Hello. Thanks for joining us.
Thank you.
I think perhaps we could wait for maybe just 1 more minute so we can have more people join us. Just hope there's no one else in the room waiting. Okay. I think for the sake of time, we can already begin. And then perhaps as we advance into the session, we will have more people join us. So, hello everyone, and welcome. My name is Ozioma, and I am a program manager for FT3. Thank you all for joining us today for the second session in our three-part series focused on enhancing shared decision-making and patient empowerment in rare disease care delivery. Next slide, Diletta, please. This series is hosted by FT3 and PEOF Plus Rare and has been co-organized by a group of experts from the rare disease community. We hope this session provides an opportunity for an engaging discussion, exchange of learnings, and collective recommendations on this topic. Next slide, please, Diletta. Before we get started, I'd like us to just go over a few housekeeping points so that this session is enjoyable for everyone. So we encourage you to be fully present and engaged during the session. To minimize background noise, please keep your microphones muted until you are invited to speak. If you have any questions, comments, or reflections during the presentation, please don't hesitate to share them in the chat. And we'll be monitoring the chat throughout the session, so we will bring questions into discussion if time allows. So please also know that today's session is being recorded and will be shared with participants afterwards. Thank you for your support in helping make this session interesting together. For anyone who wishes to follow the discussion in their preferred language, we have an AI-powered live translation tool available. You can simply follow the prompts you see on your screen to access it. If you experience any difficulties, please let us know in the chat. I will be happy to help. For today's agenda, the session will begin with a brief introduction where we'll recap some of the key learnings from the first session. We'll then move into a panel discussion where the speakers will explore how we can better empower patients during the post-diagnostic journey. Following that, we'll shift into breakout groups, giving you the opportunity to contribute your own experiences and perspectives as we co-create ideas for strengthening post-diagnostic support in rare diseases. We'll then reconvene to hear the key takeaways from each breakout group before closing with some final reflections and next steps. Next slide, please, Diletta. So before we go further into today's discussion, I'd like to briefly introduce the initiatives behind the series, just for context. So From Testing to Targeted Treatments, also known as FT3, is a multi-stakeholder coalition working to improve patient outcomes through better access to precision medicine and personalized care. We focus on making precision medicine accepted by health system decision makers, and we support patient advocates and healthcare professionals with resources and tools to improve the coordination and delivery of precision medicine at the point of care. A key part of our work is creating spaces like this, like today's session, where different perspectives come together to learn from one another and co-create solutions. You can learn more about FT3 through the link shared in the chat. PEOF Plus Rare is the other initiative behind this series, and it is a community-led platform that convenes stakeholders working in rare diseases to engage with each other, identify shared challenges, exchange best practices, and co-create solutions. So PEOF Plus Rare is an extension of the Patient Engagement Open Forum, also known as PEOF. And PEOF is a community of multicultural and multidisciplinary thought leaders who come together to define strategies that bring systematic patient engagement to life, aiming to shape a better health future for patients with patients. And so if you'd like to learn more about PEOF or PEOF Plus Rare, you can visit the links shared in the chat. So FT3 is leveraging the PEOF Plus Rare platform to engage the rare disease community, to reach and engage the rare disease community. And we're using systemic mastocytosis as a starting point for broader learning. And through this three-part series, we'll be exploring what it really takes to make informed shared decision-making a reality in rare disease care. Our first session focused on the complex journey towards receiving a diagnosis and the opportunities to improve that experience. Today's session, the second in the series, we will shift our attention to what happens after diagnosis. So how can we better empower patients to navigate this phase of their journey and participate meaningfully in care decisions? We'll then bring everything together in our final session later this year, where we'll translate these insights into an action plan. So with that in mind, I'd like to share some of the key insights that emerged from our first session. Next slide, please. So our first discussion highlighted many valuable learnings. We understood that diagnosis requires better coordination across the healthcare system with multidisciplinary teams and continuity of care playing a critical role. Patients need practical tools and resources to help them recognize symptoms, communicate effectively with healthcare professionals, and navigate what can often be a long and complex journey. Another key insight was that promising initiatives and resources already exist, but there is a need to scale what's working and make those solutions more accessible to patients. So building on those insights, our discussion today will explore three key questions. What is the patient experience after diagnosis? How can we better empower patients to navigate their care and participate in informed shared decision-making? And what approaches could help scale and improve the accessibility of existing care navigation and support tools? So these questions will guide both our panel discussion, which is coming soon, and our breakout workshops later in the session. And you can learn more about the first session through the link shared in the chat as well. So before we begin the panel discussion, I'd like to take a quick moment to acknowledge all our collaborators who have helped shape the series. As you can see on the slide, we've been fortunate to work alongside an incredible group of patient advocates, clinicians, and industry partners in the rare disease space from across the world. It has truly been a collaborative effort, and so would like to say a big thank you to all of them for their dedication, expertise, and time to make this series possible. I'll now hand over to Emily to kick off the panel discussion.
Thank you, Zioma, and hi everybody. Welcome. Thanks for joining us in the second session of the series. My name is Emily Luciani. I'm a program director with the Synergist, and I work on both the program that Zioma presented a little bit earlier, FT3 and PEOF Plus. And it's my pleasure today to be moderating the discussion with our three panelists. If you can go to the next slide, please, Diletta. So today it's my pleasure to welcome Jessica Fraser, the Executive Director of the Mast Cell Disease Society, joining us from the US. We will also be hearing from Dr. David Gonzalez de Olano, from the mastocytosis unit at the Ramon and Cajal Hospital in Spain. And we also have with us today Claudia Roquel, who is Director of the International Medical Affairs with Blueprint Medicines, joining from Zurich. So without further ado, I would like to start maybe with Dr. Gonzalez. And you can all see here the question for you, Dr. Gonzalez. We would like to hear from your perspective, what is the post-diagnostic journey for patients and how can they be better empowered to navigate that journey? Thank you.
Thank you, Emily, and thank you all for the invitation. Congratulations on this initiative because I think it's very interesting to share experiences of patients with rare diseases in an effort to identify commonalities so that can help everybody. I believe patients with mastocytosis face different milestones in the course of the disease. By far, the first one has already been commented in the previous season, and it is related to the reaching the diagnosis, which is really, really hard and it takes years. But once the diagnosis is already made, the second step would be, which is not easy, to find a doctor who is familiar with the disease. We may assume that the doctor who made the diagnosis is the one who is going to do the follow-up, but that doesn't happen all the time because depending on where you live, there might or there might not be referral centers, and they might or they might not be close to the place where you live. So that makes life complicated, difficult to patients, because sometimes, well, not sometimes, many times they are the ones who have to explain their disease to the doctors, and that is not easy. And the third milestone would be the treatment. Not all anti-mediators treatment are available everywhere. And that means that sometimes patients have to settle for whatever they can get instead of whatever they need. And going to the question, how to empower patients, let me write a letter to the three wise men. In Spain, at Christmas, children write a letter to the three wise men, and they receive presents if they behave properly during the whole year. So I'm gonna write the letter. It might be a little bit utopian, but if any of the ideas help, much better. My first idea would be to understand the disease. It is really important for a patient to know once he found a doctor, okay, to understand and to know what type of mastocytosis he has, what symptoms are attributable to the disease and which are not, what is his or her risk, what he can expect in the future. That is really important because knowledge should reduce the fear, not increase it. My second recommendation would be learn to recognize the patterns. Mastocytosis or presenting symptoms of mastocytosis are extremely heterogeneous. So one patient is completely different to another patient with mastocytosis. He should know or he should identify his triggers, his symptoms, his high-risk situations, how he responds to treatments, because it is not mastocytosis, it is my mastocytosis. A third recommendation would be try, if possible, to move from avoidance to anticipation. Many patients live in an avoidance mode. They avoid meals, they avoid traveling, they avoid exercising, they avoid doing social activities. The goal should be to anticipate those situations, carry medication, know the protocols, inform their family, to be prepared. I mean, safety should be about being prepared to do things and not about stopping doing those things. And my final advice would be, once again, everything I'm saying might not sound realistic, but it helps, it is welcome. My final advice would be try to learn living with the disease instead of wondering what mastocytosis is keeping me away from doing. Try to switch that question into how can I keep doing what I want despite my mastocytosis. Those would be my main advices, trying to empower the patient with the disease. I don't know if that helps.
Thank you very much, Dr. Gonzalez. I really love the letter to the wise men. I hope they receive it. And I would also welcome, some reactions to what you suggested. And maybe as we go to the next panelist, to Jessica, I have a question here for you, obviously, but please also feel free to react to what Dr. Gonzalez just shared with us. So my question to you is the one that you see all on the screen. After diagnosis, where do patients most struggle to engage or communicate? And what makes such moments particularly challenging? Jessica,
Thank
over to
you.
you.
Thank you so much. Happy to be here. I'm Jessica Fraser, the Executive Director of the Mast Cell Disease Society. And I really resonated with everything that Dr. David just said. I think all of that sounds great. And I loved his letter as well. To speak to my question, I think the challenges in when we're talking about patients communicating with their um, healthcare providers and engaging in their shared decision making, they fall into sort of two categories for me. So the first one relates to actually engaging with their SM physicians, the ones who we hope do have some, knowledge and understanding about the condition. But we know that like the best case scenario is for patients to form a multidisciplinary care team. So they'll likely have a hematologist involved in their care. They'll have an allergist involved in their care. They may also have a dermatologist or a GI specialist in their care, and maybe others too, depending on what their particular symptoms are. Because we do know how heterogeneous this is. And that is, that's the best case scenario, but it also comes with challenges because oftentimes, or probably most times, it's then up to the patient to make sure that all of these different specialists know what is happening, what the other one said, the advice the other one gave. If their advice contradicts each other, then the patient has to figure out how to, um, you know, make sense of all of this and get the advice they need to be part of the shared decision making. So while that is wonderful to have comprehensive care, it also is challenging because in most cases we don't have, at least in the United States, a navigator or some sort of point of contact that is bringing all of these things together. And so it's really up to the patient to sort through all of that. The second kind of category of communication challenges relates to physicians that are not SM experts. So the first one I'll mention is one that's more related to your SM care. So when an SM patient has a reaction that requires emergency care, this can be really challenging because for a couple of reasons. One, they're going to go into an emergency space where potentially the paramedic or the emergency physician does not know anything at all about SM and may not realize that if a patient is having anaphylaxis or anaphylaxis-like symptoms, that might not present in the normal way. And so you have a patient who's in distress who also has to be speaking up for themselves and advocating for themselves in a moment that's really challenging. So that is a particular challenge, and it's also a challenge for the caregiver because in many instances, it's really the caregiver then, if they're available and they're there, that has to step up and do that advocating in that space. And then the last sort of group in this second bucket are all of the other physicians that you're going to encounter in your life. We don't have systemic mastocytosis in a vacuum. You're going to have other things happen. You're going to have things happen. Maybe you fall and you break your arm, or you have to have like some sort of screening done that requires a dye. And so these non-SM experts, they're not going to know how your SM might impact or interfere with their diagnostic or treatment plan for you on this other thing that's like not at all related to your SM. And so this can really be challenging for patients because they don't necessarily know the pitfalls, but they also have to be like paying attention and speaking up and self-advocating and making sure that they're part of shared decision making. So I hope that answered your question, but those are the things that I hear the most from our community.
Thanks a lot, Jessica. And yes, thanks for sharing these challenges. And I hope as well in the co-creation session we will find some time to discuss how we address those. And I see there are some questions and comments in the chat, but I will ask you please to be patient. We will go back to them. I would like now to give the floor to Claudia, who is coming from Blueprint Medicine. And I would like to ask you, Claudia, so we know that patient empowerment models and decision support tools do exist, but they are not consistently used. So what, from your perspective, what can industry, the pharma companies do to support bridging the gap between availability of the tools and their adoption?
Thank you so much, Emily, and thank you so much, everyone, for allowing me to interact here with you. You directly hit the nail, right? It is that many tools exist, yet they are not being adopted into everyday care, whether this is being by physicians, by patients, from allowing them to achieve the best possible outcome for them. So for us, it is, of course, of high interest to support patients, to empower, to guide them on how to communicate with their physicians. David has mentioned that very much in the beginning. It's also about communicating in the very little time that often the healthcare system allows for patients to be in contact with their physicians, to clearly communicate everything that is related to the disease versus things that may not be related to the disease. And we, of course, work to try to make these tools being used in everyday practice via different levels. So if tools are not being adopted, we want to understand why they are not adopted. Is it that they are not well known? Is it that they may not serve the purpose that HCPs and physicians, that HCPs and patients would want to have from these tools? Is there anything else about the usability of these tools that keeps patients from using these tools? It can be small things that can have a critical impact on whether one can use these tools on a daily basis. But it's also trust. Do patients trust using these tools? Do these tools have good protection mechanisms for patients so that they do not have to be afraid about anything? I think this is a first critical analysis that must be run in order to understand where does the adaptation gap come from. Once that is overcome, we work on different, we'd like to work or support, if possible, via different means to support the adaptation. And we work equally with physicians and patients to drive awareness about tools in the space of systemic mastocytosis. Tools exist that allow patients to monitor their disease activity or to keep a little bit of a diary to monitor which treatments they are taking, because that is also relevant, right? What is happening in between doctors' visits? The disease is chronic. It's always with the patient, but the doctor's visits are mainly taking place only every 3 months or only every 6 months. And in worse circumstances, maybe only once a year. And there's so much happening during this time that it's difficult for the patient to communicate all that in a very concise manner to their physicians once they have their appointment. So we drive awareness together with physicians and patients. We check in with physicians and patients on the usability. Ideally, of course, these tools have been co-created with physicians and patients so that they serve the right purpose. So ultimately, we aim that the right tools are truly being integrated in the care pathway. Also, for example, by not only driving awareness, but then by also having workshops that allow physicians to test these tools in a safe environment, maybe without real patients, right? But to get more experience using these tools and similar for patients. Looking forward, these tools can only be as good as they are being adopted, and a single tool may not change the world. So ultimately, these tools must be integrated into the overall ecosystem so that we don't speak about single tools anymore, but about an ecosystem of support that best serves patients.
Thank you very much, Claudia, for this very insightful intervention. We have a few minutes actually before we move into the co-creation session, and I've seen many questions popping up in the chat. So I would like to take maybe 5-10 minutes max to go through all of them. So we have a question from Christian asking any advice on how to support patients and caregivers to deal with the fear of the unknown or the fear of unpredictability. I don't know if any of the panelists would like to comment on that, because indeed you have all also mentioned that this is a real challenge. So any advice on that point?
Okay.
Sorry, go ahead.
Okay. Well, I really understand that that is a challenge, even more in mastocytosis, where there is a mutated cell that behaves the way it wants. But from my point of view, it is important that the patient knows at a certain level, at least, how mast cell works and what the drugs or the medication he's taking or she is taking, how do they work as well, and try to at least understand what's happening and be prepared to what it may happen. And one more thing, despite we all agree that mastocytosis is really, really, really unpredictable, he should think on whatever has happened to him before, because it does not always behave the same, but at a certain point it does. As I said previously, my mastocytosis may be different from your mastocytosis. So knowledge. I know it's not a different answer, but knowledge about the disease and about the management.
Yeah, I agree with that absolutely. And the other thing that I would add is that this is a moment when the support group in your country can really be very helpful, because one, they might have tools and resources about the thing that you're worried about or feeling is unpredictable for you. And then they also may have a shared community where you can ask, like, has anybody had this happen? How did it go? What happened? Now, the caveat to that being, that's not medical advice for you. You need to take what you learn from that group and talk to your doctor about it before you make any sort of changes in your care plan. But you should certainly, lean on those voices, because they're in the same boat as you. They've been there, they know what you're going through, and they can say, well, yes, that happened to me, and here's what my doctor said, but go ask your doctor, or whatever, and that makes you feel like you're not alone.
Yeah, thanks, Jessica.
Completely agree. Patient organizations in this disease play a huge role, a huge role.
Indeed, yeah, and I've seen many thumbs up as you were talking, Jessica. So thanks for that. I will move to the next question in the chat. And this came from Nursey asking, how to prepare the way when patients know more than their doctor about their condition. What's the best way to handle that? So not only when they're in immediate distress, but like how to handle this kind of situation. Is that something that anyone would comment on? Jessica?
I can. I mean, I think probably the physicians in the room would be interested to hear what they think about it too, because I think that sometimes patients are afraid to kind of put their physician off or make their physician angry. One of the tools that we've created, which I think helps, is that we have a patient guide and patients fill it out with their SM physician, and then their SM physician sort of signs off on it. So then if they're in like another space, like maybe they're the endocrinologist because they also have thyroid disease or something like that, they can share that plan that they've created with another physician, and then it sort of has like a stamp of approval from another physician. Not that they need that, but sometimes it helps start the opening dialogue, I think. And then I think you just have to say, like, be honest and open about it. I think if you go to your physician and say, look, I understand that you didn't learn a lot about systemic mastocytosis in medical school. This is not your specialty. This is not your field. And I'm living with this disease. And here's what my experience is. And here's what I know. And here are the names of my physicians if you want to follow up with what I've said, or you want to, talk to them. Because usually, in my experience, our SM physicians are more than happy to get on the phone and talk to another specialist for whatever is going on and kind of explain why you're saying what you're saying. So those would be my kind of top thoughts, but I'd be interested to know if the other panelists have other ideas.
Well, nothing different. I mean, this happens a lot. In mastocytosis, patients usually know more than the doctor. But not and this huge difference is not only between doctors and patients, also between doctors, because I am frequently asked by my colleagues. I guess that it depends on the doctor on how humble or how open-minded they are. From my part, whenever I face a patient with a rare disease, not mastocytosis, but a rare disease, I am grateful if he helps me, because I have no idea. I mean, you have to be humble and say, I do not have idea, sorry. And it serves as an incentive to study the disease. But I don't see anything bad about telling the doctor what this is about. And now the other part is how he's going to react, but that is his problem.
Yes. Yes, thank you.
Yeah, I very much like the message that you are also giving as the expert, as the doctor, David, that one cannot know everything, right? And that you say that you are so accepting that in other rare diseases, you may not be knowing everything, to really empower patients to dare to speak up. That is so important, that everyone dares to communicate their perspective and to also clearly say, look, I have this and this experience and expertise already with the disease. I really need you to know this.
Thank you very much. We have two questions in the chat from Alex. So since we're a small group, I don't know, Alex, would you like to open your mic and maybe ask directly?
Yeah, it's I like the presentation, and actually completely it corresponds with my experience with other disease. It's not ultra rare, but actually rare disease. And also I do agree it's a big problem to understand pre-diagnosis navigation, where the patients are, what's happening, why they lost, why they have not information, why. So definitely it's disease awareness campaign and educational campaign. My first question, probably to all all panelists, but probably you can, from industry perspective, from healthcare perspective, from patient community perspective, how to make these campaigns the most targeted specifically to people. What you advise? Because actually, if you have some communication campaign, disease awareness, it's a risk. It's to be dissolved in the big community. As you rightly said, young physicians like myself 25 years ago, I studied everything, but actually I never studied mastocytosis. Never studied it. It's true. It's a problem. And my my probably interrelated question, because it's all about the patient journey, understanding patient journey. Have you ever tried to co-develop patient journey? It's question to all again, because it's a rare disease. It's probably like a consolidated, just joint efforts to develop, publish this information, populate this information. Yeah, thank you.
Thank you for your questions and for sharing your experience.
I'm happy to start with
Yes.
trying to be targeted. So of course we have been interested in understand where we can find systemic mastocytosis patient advocacy groups. That is of course our first address when it comes to targeted communication to patients, and also to seek interaction and collaboration with patient advocacy groups, right? Because it's a tremendous expertise base in these advocacy groups. Second, it may also be that patient advocacy groups of diseases that have a high overlap of symptomology. Sometimes these patients, sometimes there are patients who in fact actually have systemic mastocytosis. So to also drive awareness among that advocacy groups that they may think about other diseases as well, and try to understand the diagnostic journey that they would need to follow in case they suspect to have the disease. And third, you mentioned whether we work together with patients to map the patient journey and the challenges in the patient journey. Yes. So unfortunately, my colleague Christian, he has just left us, but Christian, he is our patient advocacy lead. And he is working a lot together with patient advocacy groups. Every year he hosts a patient summit where actually these key barriers are being discussed and also then ultimately discussed to be overcome.
Thank you,
Thank
Claudia.
you.
Any other panelists who would like to? Yeah.
The only thing that I would like, the targeting part is really hard, right? Because like we know the problem just feels so big, and it's really easy to spread yourself too thin, especially for a small patient advocacy organization. So what we've tried to do is, we know that we could be trying to touch, 5 or 6 different specialties, and that's really hard to do. So I think we've done an approach where, for example, like we do physician education programming that's accredited for continuing medical education units. And so, we do kind of send out a wide invitation just to kind of make sure we've hit all our bases, but then we've chosen a few specialties to really try to like go in deep on, and really spent a lot of time educating those folks. And hopefully eventually we'll get a lot of traction there and we can kind of move on to someone else. But it's really easy to spread yourself too thin, and so you just have to kind of triage, decide what is the most important thing. You can't drink all of the ocean. You have to just sort of do what you can.
Yeah, thank you. I understand also it's a multi speciality. Sometimes we need several specialists. It's making this task more complicated even.
Yeah, indeed. Well, thank you again to our 3 panelists for your presentations and answering our questions. I think now the time has come for moving into the second part of our session today, which is the co-creation workshop. So I'll hand over to Ozioma to take us through it.
Thanks, Emily. And thanks everyone for the interesting conversation. Before we move to the co-creation activity, So in next slide, please, Diletta. So in this next phase of the session, we'll be focusing on specific themes. And these activity will last around 30 minutes. We'll be split into different groups. And then after that, we'll return to the main room to share the key highlights from each group. And then we'll wrap up the session. So we encourage you to actively participate by sharing your own experiences and perspective, just like you're doing here. Let's, engage in a discussion. You can feel free to either speak up, add questions in the chat, just like you're doing now. So yeah, thank you so much, and we look forward to seeing you in the breakout. So Matt, I'll let you split us now into the groups.
Our group is back first. You're muted, Emily.
Yes, I was just saying hi again, and I hope we haven't lost too many people in the transfer process. Where I see people are. It seems that the other group was finishing their last comment.
Yeah, I think we were transferred one by one as well, so it might be a slow process rather than as a group.
Yeah, indeed. Oh yeah, and I'm told the other group is wrapping up. So they
Do you have any last moment thought you would like me to write down?
Now I'm muted. Since we have a minute or two, I am going to show off this resource. Well, can you see it? No, you can't see it because I've got a background. Darn it.
You need to remove the background.
We have a new resource that walks patients through how to prepare for a physician appointment. And I'm really excited about it. It's not out yet, but I think I'm connected with PEOF and they're going to link it or something once it is. But and all the other SM, we're going to share it with our international partners, but it really has patients focus in on what's your most bothersome symptom, because we know that the physicians don't have an hour to talk about all the 17 things that are going on. So what are your couple most bothersome symptoms? What exactly are your goals for the appointment? And it just really gives people a step-by-step framework. So we're hoping that will be a useful tool for this sort of discussion and shared decision making, but we'll see. It's not out yet. So we've created a thing and now we have to see if it's useful.
But it will be out by our next and third session of the series, right? So
it will be.
Hopefully we'll be able to disseminate it. And
For those of us who have
everybody.
joined, Jessica, can you say again what the new tool is, since we've just joined
we
you?
have a new tool. It's called the Empower Workbook, and it is about empowering patients to be prepared for their physician appointments. And so it kind of walks them through a step-by-step framework of, choosing their goals, listing out their 1 to 3 maximum most bothersome symptoms so that they can really focus their appointments in. And then if they have other things that are bothering them, it encourages them to make another appointment. It's really tactical. So if you have to show a picture of skin involvement, where's the picture? Where do you have it saved? Can you get to it quickly? Planning all of that stuff out so that you're not in the doctor's office scrolling through 45 pictures of your vacation trying to get to the day that you had really bad urticaria. So it's really tactical and we're excited about it, and hopefully it will be a useful tool, and it will be out by the time we do the last of these sessions. So it will be able to be disseminated.
Ozzy, I see you have your hand up.
Yes, I just wanted to build on what Jessica was saying as we are talking about resources and tools. So also in our group, we were discussing very similar things, and we had some resources highlighted, like the TAMS question to ask your doctor to help people to help patients be more confident in communicating with their clinicians when they go on their appointments. We also, the must-have app was also mentioned. Then there was another TMS tool where doctors can fill information. And now we are hearing about Jessica's tool. I also wanted to mention that in FT3, we have some adaptable, customizable resources as well. So they are not specific to any disease area, but different types of diseases can use them. So they are mainly for enhancing patient awareness on targeted therapies and empowering them to speak about, targeted therapies or biomarker testing with their doctors. And we also have this tool where patients can understand their biomarker testing in a patient-friendly way. So if any of these resources might be helpful to patients or HCPs in the rare disease community, we'll be happy to share them with you. Okay.
Thanks, Ozzy. So I think now we're all back together, and it would be nice to hear from each other the reflections. And since we're a small group, we can, maybe take some time to build on each other. In the group I was in, that was moderated by Jessica, we talked about how we can support patient empowerment in care decisions, and we also talked a little bit on about how to bridge the gap between the availability of tools and their actual use. So maybe Jessica, if you want to share a couple of reflections, or anyone who was in that group, and then I would be also very curious to hear from the other group what you discussed, and also if you have reactions and questions or comments on what we mentioned in our groups. We have maybe, I would say, 10 to 15 minutes, so to have this discussion.
I was actually going to say, I wonder if Diletta could give a couple of overviews, since she was so diligent in taking notes. I think,
Yes.
Go ahead, Diletta.
You're with me.
Yes, we are in the same. So it was just a technical issue. Let me just freeze the screen 1 second. So some points that came out are that it's not only about let's say communicating the tools, but it's also about communicating the transparency behind the tools. So we talked about explaining why certain tools are how they're being created, who created them, why are they useful, so to make the trust the building case for the patients. We talked about AI as one of the supporting tools. We talked about the roles of physicians in knowing about the tools, because they are the ones that are going to be distributing them, and these tools should be very intuitive, not only for the patients to be received, but also for the physicians to be able to explain them. Of course, correct me if I'm wrong, or feel free to jump in whatever point. We also talked about how patients should be feeling safe to use those tools. And on a higher level, we also introduced the idea of partnering with the rare disease umbrella organizations. So even if the rare diseases are very specific and each of them have their different goals, at least there is one central point of connection. We talked about scientific papers being translated in a lay language, and in that lay language be given back to the scientific paper, so that everybody understands each other's language. I don't know, Jessica, this is what you said, if you want to correct on that. I think it was very interesting. And endorsement, the endorsement part as a reliable sources, both from the physician to be recommending it and for the patient to be using it. And also, Jessica, you shared a new resource that helps patients prepare for the physician appointments in a step-by-step framework. So I think that's also very interesting. I don't know if anyone in our group
I think you got
Yes.
it.
Thank you.
So maybe, I don't know if anyone from the group wants to add, or like from the other group, any reaction to these recommendations. You know, I'm wondering if like the doctors online with us today have any reaction when it comes to, you know, how to make this intuitive, not only for the patients, but also for the physicians. Any comment on that?
Well, we commented. I don't know if Ossie was going to comment on our discussion, but if there is an app or a device or whatever available which is able to measure different fields of the disease and which is also helpful not only for the patient but also for us to do a follow-up every 6 months, that would be great, because it helps not only to list the concerns but also to have an objective parameter to measure how he's going. I guess that is what we are all looking for.
Yeah. Thanks. Anybody from the other group? I know you guys indeed discussed the patient clinician communication. So any other thoughts that came up from your discussion that you would like to share with the full group here?
I didn't say it terribly articulately in our group, but one of the things we try to teach patients is to understand their audience. So, and what you need from the conversation. So if you're talking to an experienced doctor, that's one conversation and one set of questions and that you can prepare. If you're going into a clinician who doesn't know the condition, then that's a different situation, and you're trying to work together with them in a circumstance where they don't know your disease and you don't probably know much about what they do. So, for example, the mastocytosis patient with a newly diagnosed other cancer. Well, that other doctor is very expert at their cancer, but doesn't know how the two interact. And so that's a different kind of conversation where you're both kind of feeling your way forward with different sets of information. And sometimes the sort of lay summary is actually really useful for the patient to give to a non-expert doctor. So it's not just the patient who is a potential audience for that kind of thing, but somebody who isn't going to, quickly get themselves through, a full medical article that you hand them. But if you were to give them a summary, it certainly could help. So teaching the patient to predict the kinds of things that may arise with a particular audience and then anticipate that in ways that make them more empowered to have that conversation.
Thanks a lot, Jess. And I don't know how it was in your group, but that was very well articulated here and very well understood. Yeah, so I don't know if anyone would like to add from that group. Ozzy?
Yes, I think our group didn't get to discuss like how tools can be made more accessible and usable across the rare disease communities, how to reach, patients with varying levels of health literacy. So maybe we could take a moment to throw this question out to the group if anyone has any extra ideas to share.
Yeah, thanks, Ozzy. I'm gonna put the questions in the chat, so maybe it's also easier to check. We had started discussing that in our group already.
Yeah. And we've already seen some interesting insights from the conversation that we just had, like partnering with umbrella patient organizations, building trust for patients. So, and this mainly came from the first group. So anyone in my group who wants to also share ideas, feel free to.
May I add something? Actually, in my previous experience, we had very good positive I wouldn't say it's umbrella organization. It's probably non-government organization or initiative just supporting orphan disease and rare diseases. So I'm talking about European Reference Network. Probably some of you know them. And what they did really well, approximately, as I remember, for rare neurological disease sections, they had like a shared the patient experience map and translated this map. So originally MAPS master version was developed in English. And actually, because patients have no obligations to know English, right? So patients speak in different languages. So we translated and we supported as a company, we supported European Reference Network initiative with translation to all other languages and very, very professional translation, not just artificial intelligence. And we translated patient experience maps, patient experience journeys, and shared that. So patients had access to that and actually understood what's going to be next. Why journey is very helpful because they can see step 1, step 2, step 3, and what's the desirable step, what's the expected step. So that's why I'm asking about patient journey. So probably it's one of examples of very good awareness and scientific support. I'm not sure it's covered all rare diseases community. Probably you know much better Eurordis, organization like Eurordis working on cross at like umbrella all rare diseases. But at least European Reference Network focused on rare neurological, neurodebilitative conditions, so neurodegenerative conditions. So it's really, really helpful for patients, as far as I know.
Thank you very much, Alex. Is there any other thought on bridging this gap between the tools and their actual use by the patients, by the caregivers, by the healthcare providers?
I was just going to follow up quickly on what Oleg said. One thing that we've had challenging thoughts about with regards to the ERNs is that they're not really well designed for conditions that cut across specialties. So we don't actually fit it, really obviously in any of them. And it's a problem that, that we struggle with in terms of teaching doctors and trying to develop networks that we have to address the dermatologists, the allergists, immunologists, hematologists, gastroenterologists, et cetera. But I'm going to let Kristen hop in and tell you about what we're thinking about to try to improve kind of the impact of all of our groups.
Thanks, Jess. We've been working together over 25 advocacy groups for the last 9 years for Awareness Day. And we've realized, obviously, we work very well together to promote systemic mastocytosis and mast cell diseases for that day a year. But there's a lot of things that we can do better together. So we're looking at now investigating how we can formally work together. We're in the very early stages of investigating if we form an alliance or anything like that. So I won't go into too much detail. But yes, it's very exciting to know that we'll be able to form an umbrella group style organization to better support patient advocacy groups, patients, doctors, and everyone who's involved in diagnosing, supporting, treating mast cell diseases. So it's very exciting. But as I said, very early days, but we're excited about where it's heading.
Yeah, congrats. It's amazing. And thanks for sharing. Just gonna give a last chance for anyone who would like to add anything to the conversation before we start moving into the end of the conversation and closing the session. Katrina, I see you have a yes, please go ahead.
It was just reinforcing that idea of the broader uptake of resources, but also as well as disease awareness, as well as to go beyond maybe the SM community and work with symptom related associations. For example, there are, organizations dedicated to anaphylaxis, if that is an aspect of SM, or skin related organizations, because there may also be patients who are misdiagnosed or as yet undiagnosed who are within those communities. And if they learn about the disease and they understand the symptoms, then that might help that broader awareness of the disease as well.
Yeah,
I
thanks,
think somebody else
Katrina.
had mentioned that earlier as well, but I just think it's a good way of expanding.
Indeed. Yeah, this is a great point, and in a way, at our humble level as well, this is why we have this PEOF plus rare conversation. So it can, different rare diseases can also learn from each other and support each other in this kind of conversation. So although this session and this series of session is focused on SM, it's a broader umbrella that we can also use. And if any of you has ideas or the willingness to use it, please do so, because we're here for that as well. Which is actually a perfect segue for me to let you know a little bit more how you can further get involved. And so, of course, we have this series, and we would love your further inputs. Help us co-shape the next session. We've had a first session more like on diagnosis, and now what to do after that. So on the next session, get in touch with Ozioma if you would like to help shaping it, and also help us amplifying the learnings and the recommendations that come from these sessions. We will obviously publish them on our platform and social media. So we count on you as well to amplify and make a bit of noise around this discussion. And as I said earlier, while in those sessions we focus on SM, we have a PEOF plus rare broader umbrella. So if you are interested in co-creating a session with us, you can reach out to Eleonora or also to Ozioma or myself. We're all in the same team, and very happy to discuss more how we bridge the SM community with the PEOF plus rare community. And lastly, if you would like to contribute in the work we do in FT3 that Ozioma presented earlier, and that can be on, how to maybe pilot, implement some of the adaptable resources that we have in your own context, in your own country. That's also something that you are warmly invited to do, and you can contact me or any of us to do that. So this is a little bit like internally, but also I would like to give the floor next to Christine, and if you can go to the next slide, Diletta. Christine is coordinating the International Mastocytosis and Mast Cell Diseases Awareness Day. So please tell us how we can get involved.
Definitely. Thank you, Emily. So International Mastocytosis and Mast Cell Diseases Awareness Day takes place every year on the 20th of October, and it's organised by 29 patient advocacy groups and affiliated supporters from around the world. This year will be our 9th global campaign, and we work to bring awareness. We work to bring together patients, advocates, clinicians, researchers, and organisations to increase awareness, drive research, improve treatments, and foster a greater understanding of mast cell diseases. This year's campaign will focus on sharing patient stories. We know that every story helps to raise awareness, it builds understanding, and it reminds people that no one's facing these conditions alone, which is really important. You can follow us on Instagram, Facebook, and LinkedIn. Just look up the Awareness Day name, or visit mastocytosis-mcas.org to access all of the resources from our past campaigns. So last year we put together 5 patient fact sheets, which were translated into 9 languages, in addition to having video interviews with 3 experts and a lot of social media collateral. You can browse our list of patient advocacy groups and support groups in each country. And in the coming months, you'll be able to learn more about this year's campaign and how you can participate. So we'll be putting out a call for patient stories very soon. Additionally, as you can see on the slide, be sure to take a look at the May 2025 edition of the Rare Revolution magazine, which was sponsored by Blueprint Medicines and was dedicated to systemic mastocytosis. It's a free online magazine, or that edition is available for free. And we hope that the work that we're doing will help make mast cell diseases, including systemic mastocytosis and MCAS, better understood around the world. So thank you, and thank you for this really great chat today. It's been really informative.
Thank you very much, Christine, for sharing all of that. Before we say goodbye, if I can ask you, please, we would like to know what you thought about the session. So my colleague Matt just, you just see a pop-up, you should see a window popping up asking you what you thought and how much you would recommend this session to a friend of our colleague. So please take a moment to submit your feedback here. And then I guess we are coming to the end. I would like to thank you all very much for the super interesting discussions. It was really a pleasure to be with you today and to listen to all the experiences, the recommendations, the learnings, and it's really a privilege for us in this team to be able to support building this community, these tools, these resources. So we will continue doing so in the next session, which will happen in October. And in the meantime, we will share, of course, the main takeaways and the main learnings from this session with all of you and with the broader community. As I said earlier, please help us amplifying your voices, actually, and raising awareness. Thank you again so much to all of you who contributed, and I wish you a very nice rest of your day.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you very
Bye.
much.
Thank you.
Thank you.
Bye.
Bye.
Everybody.
Bye.